So I'm Katren and that's my email address there, and my Twitter account if anybody's on Twitter, and feel free to tweet these. So the topic of my talk today is seeking help and giving help, which I've sort of subtitled as being grateful for connections. And so I just want to talk a little bit about my wellness journey and how I got to where I am. So I'm not a psychiatrist, I'm an emergency physician. Peter is the expert on physician suicide. But just as a reminder of how serious this can be, approximately 400 people, physicians, kill themselves every year. And that's probably a huge underestimate, in fact, because physicians are probably pretty good at hiding it. Last Monday was actually Physician Suicide Awareness Day, for those of you who don't know. So just to sort of underscore how important depression can be in physicians, it's really important we treat it. Because of our medical knowledge, we're very good at completing suicide, so just be aware about that. I'm not going to talk about that anymore. I'm also not really going to talk about the medical record. I do 100% agree with everybody else that, in fact, most of physician burnout and lack of wellness is extra personal. It's not from us. It's from the health system. It's from the institutions in which we work. But that's not what I'm going to focus on today. And sorry to anybody who gets PTSD from the Epic login. Okay, so these guys don't need more wellness. They need a better working environment. I agree. But we only have so much control over some of our externals. And so what I really want to focus on a little bit is some of our professional choices. Now, this actually doesn't project quite as well as I'd hoped, but so this is every single thing wrong with every single medical specialty. So here we have medical students here. So you're either crazy or sane. So here, crazy, do you have an attention span? So non-existent attention span, crazy, emergency medicine. This is published in the British Medical Journal. You're welcome to find your own pathway. Okay, so I just want to also talk about how sometimes burnout is really something that fluctuates over time, right? On my first shift of a run of shifts, I'm like the nicest person. Can I get you a blanket? Would you like some graham crackers? Let me look in 3 different fridges to find a turkey sandwich. By the end of my run of shifts, I'm like, get your own damn sandwich. I am like toast. Okay, anybody seen this slide before? So this is from the Mayo Clinic. This is the 2015 study. And so down here on our x-axis, we have the percentage of burned out, and here we have winner, winner, chicken dinner, emergency medicine, the most burnt out specialty. But here's the paradox, right? Because here is the percent of satisfaction with work-life balance, and we're actually the 4th highest specialty. So part of that is why I'm actually feeling a bit tired today, is because shift work, right? So one of the things about shift work is it actually frees up your Wednesdays, but sometimes it also takes up some other time. So when you're looking at these kind of where your specialty fits, think about what the strengths of your specialty are and what the weaknesses of your specialty are. And sometimes those things sort of change over time, and what looks good when you're in your early 30s significantly changes as you get older, and frankly, working weekend shifts gets old. Working holidays gets old. Constantly having to be the one that is at work does actually get old. So I'm mostly really going to be talking about the sort of that low-level ennui and burnout that we often have as physicians. Pretty close. All right, so personal resilience. The reason why I like this is because this is the one thing that we have control over. All that other stuff, we have very limited control, but we do get to control how we spend our time outside of work. So this is my family, there's me, that's my 15-year-old daughter, my 10-year-old son, and my husband. So I turned 50 this year. My husband is also an emergency physician. Obviously, you can tell from my accent, I'm also an immigrant. That's sort of our nuclear family. This is the start of my wellness journey. This is when my son turned 2. We had a little animal party in our backyard. And the reason why this photo gets shown in every single wellness talk is that my butt is the same distance as At which point I knew that I had to start making some changes. So the first thing is to help yourself first. Put your own life, put on your own oxygen mask, right? You can't help other people unless you are intact yourself. Pretty much all of physician wellness is around some theme of eat, sleep and play. I started a run streak nearly 2 years ago. This was me last weekend with one of our nurses actually, and this was day 701 for me. Asking for help comes from a sense of strength, not from weakness. Thank you, Angela. Help others when and where you can. That includes volunteering. I also think it involves creating the culture of wellness, which means you model the behaviour that you want to see in other people. Use your sick leave. Don't come to work when you're sick. Don't ask how you can help, just do things. This is the Women in Emergency Medicine at our residency graduation. It's our current residents and some of our faculty. Sometimes you're going to find your support network online. I'm also very interested in geriatric emergency medicine, and so I'm very active on social media, because that's actually where geriatric emergency medicine is. Practice reciprocity. It becomes then life-sustaining. Here we are at just having a women's night out. This is all emergency medicine physicians or residents. And a shout out thank you to all of my people in emergency medicine who keep me strong.